my name's Lee Salter. I'm the Senior Program Manager for both ODMap and Case Explorer within the Washington-Baltimore HIDA. So in my role with ODMap, I work with state and local governments to help them deploy ODMap in conjunction or to enhance existing surveillance efforts that they may have surrounding the overdose epidemic, and really helping to bring together public health and public safety to share information both within their jurisdiction and also encourage data sharing across jurisdictions and agencies as well. So ODMap stands for the Overdose Detection Mapping Application Program, and ODMap strives to provide near real-time suspected overdose surveillance across jurisdictions to support both public safety and public health efforts to mobilize an immediate response to a sudden increase or spike in overdoses. So the way that ODMap works is it's open and available to any government entity serving the interests of public health and or public safety as part of their official mandate. It's also available to private licensed first responders. So if a jurisdiction has a private EMS company, for example, completing the bulk or majority or some of their EMS services on behalf of the county or city, and they can request access to ODMap. And then it's also available to emergency departments and hospitals for the purposes of collecting non-first responder transported overdoses. So the way that it works is it's in near real time. So we don't have toxicology back yet. We don't have crime lab back yet. It's based purely on a first responder's training and experience, combined with how that person is presenting themselves clinically, along with any other evidence that could be on scene. So there's two ways to submit data into ODMap. The first is manual entry. So for example, for law enforcement, when they're on scene of the overdose or right afterwards when they're submitting their paperwork, they just log in to ODMap. It's a web interface, so you can access it anywhere that you have either cellular or Wi-Fi connectivity. You can access it, on a cell phone, a mobile device, a desktop, a mobile data terminal in your patrol car. It takes less than a minute, and it's pretty quick and easy. It only collects a few required fields, and so the first one is the location. Next is date and time, then fatality status, so whether or not non-fatal or fatal, and how much naloxone was administered. There are several other optional fields that we do find the majority of our law enforcement is collecting. Things like the primary suspected drug, additional suspected drugs, as well as if the person was transported to the hospital and other items like that. The second method to get data into ODMap is you can connect it seamlessly to a record management system. And so there's something out there called an application programming interface, or API. But for non-technical people, all you need to know is that there is a method that can connect ODMap to your record management systems or wherever the data is housed, so a data repository. So think of it as soon as a police incident report is submitted to your native system, it will then connect directly over to ODMap. So that's a quick and easy of how data entry works. The second piece of the platform is a national map. So you can see overdoses nationally, but more importantly, you can see them in your jurisdiction. There's a bunch of filters and built-in charting for you, so that you can have a better understanding of both geographically, but also within time of where and when overdoses are occurring, to help law enforcement partner with public health to do things like harm reduction and outreach or other efforts that are ongoing. The opioid epidemic was declared a national public health emergency in October 2017, and it's still an active national public health emergency. So although public health is in there, it's definitely something, it's an epidemic that has affected both public health and public safety. And when we talk about data collection, law enforcement and public safety in general are the boots on the ground. They are the people that are responding to overdoses as they occur. And as a result, they possess some really critical data that would be really beneficial to public health partners in order to share that data and conduct outreach and conduct efforts that can hopefully increase population health, do some interventions for non-fatal overdoses, post-outreach efforts to help save lives. And so by sharing that data that public safety possesses can really help to improve the overall quality of the population. So the first piece is sharing that critical data. The next piece is by putting the data into action. So once you have that collaboration and that partnership happening, that's where some really exciting things can happen. So we talked briefly about conducting outreach and harm reduction, and I'll kind of talk into that in a little bit about some best practices, but also just for awareness. You may have, as law enforcement, some situational awareness, especially if you are in a supervisory position. You kind of know calls for service. You may know, yes, our patrols responded to an abnormal number of overdoses last Tuesday when you go back and look at calls for service. But ODMap can really help just put those on a map. And so you can really better understand if there are specific neighborhoods that are adversely affected. And so maybe where you were conducting harm reduction services previously or outreach, just getting information out there about ongoing treatment and prevention that's occurring, you can start to tailor what you're doing and adapt with the epidemic, because which neighborhood is adversely affected today is probably going to be different, or there may be other ones next week. So ODMap really helps make the data digestible, so you don't have to go back and abstract calls for service. It's already in one central repository where both law enforcement and public health can access the same data when it makes sense for them. So you're not having to go through extra steps to share that data. You're looking at the same data at the same time. So since ODMap really made its national debut in April 2017, so we have almost 3.5 years of some best practices. And we're really fortunate for that. ODMap reaches a diverse landscape, both geography, of disciplines that are participating. So we've been able to gather some different examples, and that's really important to highlight because what works in one jurisdiction may not work in another jurisdiction. Everywhere is specific and unique, and so everything that they do will be tailored to what's happening where they are. But one of my favorite best practices is in Erie County, New York. They started utilizing ODMap in fall 2017, so we've been able to learn from them for the past 3 years. And so it's evolved, as it should, right? You kind of learn as you go, and you can adapt and tailor it and really move and form to what's happening right now. And so you really need to have a convening of people, and you need to talk about data intentions. That's really important because data sharing can be, it can be scary if you don't know how that data is going to be utilized. So set out intentions and frameworks and how, if you're going to be giving data to public health, how will they use it and how will it be measured and evaluated? Similar to what Erie is doing, I think it's so important that when you implement a program that you continue to evaluate it so that you can learn from it and also measure your successes like Erie was able to do. They're able to look at when they implemented the program and then kind of the results of what was presented. So that's a best practice that I like to always bring up, and it can really be tailored to what makes sense for you or expanded as well. is the exciting part. Hopefully, you know, some of this has sparked some interest, or maybe you want to learn some more, or you're ready to request access. So it's really easy. You can do all of those things at odmap.org, and there's some other helpful videos on there. There's also training, webinars, training manuals, lots of stuff to kind of interest whatever your direction you're looking to go in. But most importantly, if you haven't requested access yet, there's a button on there called Request Agency Access, and you can just do it all online. It's really easy. And then the second step would be to convene a multidisciplinary meeting. So before you get started with ODMap, we always recommend to kind of set up those data intentions and also a framework, and start talking about how you're going to share data in ODMap, and then what you're going to do by putting that data into action. And that may not all be solved in one meeting, you know, but it starts to get that conversation started so that you can start putting things into action step by step. So those would be the two immediate steps that I think would help propel ODMap into action and data collection between law enforcement and public health. You know, don't wait. I think it's really important to start now. You know, as a prior law enforcement officer myself, one of the things that I always struggled with was wondering what else I could do. And so ODMap really helps take that next step and helps be able to put data, and I always say data lightly. You know, these are people, and it really helps just conduct outreach to your community that you work in. So I just say don't wait, you know, because unfortunately it is an epidemic. People will continue to unfortunately die. And so just don't wait. Start putting something into action now.